Okay. Good morning, community, and open arms family and friends, whoever is available to watch. This morning we bring you some information from all the way from Atlanta, Georgia, and Jacksonville. We are sponsored by Gilead, coming actually out of DC, right? The company.
No, a company in California.
Oh, California. So this morning we want to talk a little bit about the important respiratory viruses that are affecting our community right now and the importance of the vaccines. So first we have to discuss our favorite topic over the last 3 years, COVID-19. We have Dr. Chinonso Akano, who's a pharmacist with Gilead Sciences, and he's going to give some information on COVID-19 and the vaccine. So let's give him our attention.
Thank you very much. Thank you, Dr. Brown. Thank you so much for the invitation, and it's a pleasure. I represent Gilead Sciences. My name is, like Dr. Chinonso Akano. I'm born and raised in Lagos, Nigeria. I lived here about 24 years ago for school and stayed in school, and now I'm practicing as a pharmacist for Gilead Sciences. And we're focused on viruses. We try to eliminate viruses, provide treatment, prevention for not just COVID-19, but also we're working on trying to eliminate HIV. We have therapies against HIV, we have some hepatitis, we have some, now we're into oncology also. We're trying to develop medicines to treat cancers, especially triple-negative breast cancer, which affects most Black folks and does affect anyone else. So, great company, and they're doing the right thing in the community. So I'm here to represent them. My topic today to you is to specifically talk about COVID-19 in an effort to really help us continue to have a discussion about COVID-19 and be able to outreach our communities and people told that this is mostly effective across the country. So I will start by the objective of this talk today is to provide scientific information, but I want to try to make it in a simple format where we can really get to understand it, discuss it as a pioneer in the community, and be able to educate our peers, our colleagues, our families, people in our churches. So at the end of this presentation, you'll be able to describe the impact, understand the impact it's having in our communities and in the U.S. Describe how we can slow the spread of the virus, as well as explain some of the FDA recommendations and some of the approval processes and why we should get vaccinated. And then finally, we'll talk about some key precautions that are available for COVID. So right now, the impact COVID is having in our community, especially in minority communities of color, is that as of right now, as we speak, there's over 95 million, more than 95 million cases in the U.S. of COVID. And out of that 95 million, over 1,050,000 plus people have died of COVID. That's a huge number. I'm talking about numbers, but think about people behind those numbers. These are, mothers, children, parents, uncles, aunts. These are people that we love. And I know some of us know people that have really been affected by COVID. So, quite tragic, but these numbers are really sad numbers. And these cases continue to grow in our communities. The numbers are still going on. COVID is not over yet. It's still ongoing. So it's good to stay protected, and I'll talk about those a little bit. So some minorities, like I talked about earlier, is disproportionately affected or impacted by COVID-19. The cases, the hospitalizations that we get, when we go to the hospital, we see mostly people of color that are affected by it, deaths as well, compared to our white brothers and sisters. And other folks are also the Hispanic brothers and sisters, Latino brothers, and they're also affected by this. Why is that? Mostly because of many things, actually. Socioeconomic factors, the way that we live as a community. We live, we eat, we break, we try together. Some of us work in the service industry, so we're really out there, trying to earn a living to take care of our families, and we get affected by the virus. So, and the other factors as well that predispose us to the virus. But I want to talk a little bit also about the long impact of COVID. You all heard about long COVID, right? So the long impact of COVID, or sometimes it could be called post-COVID syndrome or post-COVID condition. And some of those conditions are like cardiovascular conditions, so heart, chest pain that we get. People who have had COVID continue to have some of those chest pain, and their heart keeps beating a little faster than normal. Those palpitations occur. So that's our cardiovascular condition that gets affected. Neurologically as well, we have people who have brain fog, can't really remember things clearly as a result of COVID. Brain fog does occur. We have infrequent headaches, sometimes it's more severe, sometimes it's not, and dizziness also. So all these impact our neurological ability to function cognitively as well. Musculoskeletal, meaning in our muscles and how it affects our skeletal system. So people get really fatigued and they can't really move as much as they want to. Joint and muscle pain, right? It gets a little bit worse than normal. Muscle aches and all that. So it does affect our musculoskeletal system. Then respiratory, because it's a respiratory virus. So cough, shortness of breath are the predominant ones that continue to linger over time. Now it does affect other organs as well. Our mental health, for example, overall. It does affect our mental health, kidneys. It affects our kidneys. We get injured in some cases. Skin abnormalities get reports of that too. Autoimmune conditions get affected. Ability to fight viruses, ability to stay healthy. Those get affected as well. So these post-COVID or potential post-COVID conditions continue to linger over time, and we don't really understand. We haven't really done. There's some studies out there, some trials that are still ongoing to understand what these potential post-COVID conditions. What does it impact over time? What impact does it have daily? What are the long-term effects? We're still trying to understand some of those right now, but so far, the ones that I just mentioned are the ones that are continually being reported by folks who have had COVID. Now, in our society as a whole, it's affected jobs. It's affected the way people live their lives, and these are the numbers that are going to. I'm talking about trillions of dollars. So it's affected our society here in Jacksonville, in Atlanta, just the U.S. generally. It's affected our health. If it affects our health, it also affects our dollars, right? So there's dollars behind that. And then our mental health impairment, people not being able to really take care of the family because of the mental, capacity or the mental impact it's having. And when people go to seek for help, it costs a lot of money. So that's over almost $2 trillion or more than that right now. So all these dollars affect our society in general, and these are not money that is really that's coming from us, that is used to take care of some of these impacts or long-term health impairments that we have. Now, how do we slow the spread? So some things we need to think about. Number one is we need to get a vaccine. It's free, and that's how we do it. And how is it spread? You guys know how it's spread. High-touch surfaces, mostly it's respiratory droplets when we're speaking, and people inhaling those droplets. Airborne transmission, we're understanding that now. And how do we take a step to curtail this? We talked about wearing a mask, very important, as most of us are. Staying 6 feet apart from each other, washing your hands often, hand sanitizer is very handy. Avoid crowds, especially for some of us who have autoimmune disorders, who have weakened immune systems. It's important to make sure you clean and disinfect some of those high-touch surfaces that we get to. Other people start shaking hands and all this, sanitizing hands, because our immune system is weak and it makes us really weak. It's easy to really get the virus and it affects us that way too, especially for those of us who are getting older and stuff. We have to take care of ourselves. So the CDC has actually really encourages us to stay up to date with COVID vaccines, and they have some recommendations which I won't go through everything, but I wanted to highlight a few things. That vaccines, yes, there's a lot of people and a lot of things in the media about why should we get vaccinated. If you have COVID, why get vaccinated, right? But there's data behind getting vaccinated because the vaccines help protect us against COVID-19. It's very important. It's not media. It's actually facts. These are research that has been done. So please, getting vaccinated is one of the many steps you can take to help protect yourselves and others from COVID-19. A person that is up to date from the shots or the vaccination, it's recommended that they actually get a booster vaccine, right? That's very important, especially the second booster vaccine, which is when you get the complete, after the first 2 Now there is the new booster, the bivalent booster, the new one that is coming out that has really protects us from the Omicron subvariants, the BA4 and BA5. Those ones are the most contagious ones, the ones that get us really sick quicker, but likely doesn't kill us or puts us in the hospital as much as the previous variants of concern like Delta and the previous one. But this one is important that the bivalent vaccine, if you haven't gotten your second dose yet, to actually consider that, because it does protect us from the current variant that is available now, the BA4, BA5, that is really, really contagious. And then, how does the vaccine work? It actually works, it teaches our immune system to recognize and fight the virus that we take into our body. And that's what causes COVID-19. In simple terms, that's what the vaccine does. So let's please encourage one another to not just get the first two or the first, but get your boosters up to date, especially, and I think that we'll have to talk about, flu, especially this season where it's scary what the projections are looking like for this year. So please, get talk about it, get the flu shot, get the vaccine doses up to date. It's really, really important. So COVID-19, like I said, it's actually effective against the new COVID-19 variant. So when people say, oh yeah, don't get this, don't get that, whatever's available, please get it. It's important that we get it. I got the Pfizer one. My wife got the Moderna one. So everybody gets different one, but it's important to get the shot. It's better than nothing. Because research has shown that COVID-19 vaccines used in the U.S. does protect us from severe disease, it protects us from getting hospitalized, and it protects us from dying from the virus. And these are the facts, and it protects us from also the variants that we're all concerned about. And the CDC continues to highlight this, and there's current information on this online, but I'm not going to go into that. I talked about the trials and the companies that have vaccines available. There's Pfizer, there's Moderna, there's J&J, Johnson & Johnson one, and there's a new one by, what is it called? Novavax. There's a Novavax, so there's 4 different vaccines available. So anyone, I think the Novavax is the recent one that just got approved a few months ago. But all of them are all effective. They're all, the FDA has approved, I think, 2 of them. The other ones are still under EUA, they're still authorized, but they're not fully approved by the FDA. And some of these vaccines have studied some of us more than they have studied our white brothers and sisters or Hispanics. I'll give you an example. The Pfizer vaccine, for example, had only 9.8% of African Americans were black folks in the trial. Just 9%, and over 80% of white folks in the trial. And I'll talk about this at the end, the need for us to get involved in clinical trials. It's important to highlight. The Moderna vaccine had about the same, 9% also, 9.7%, and had almost 80% of our white brothers and sisters. But Hispanics actually was a little bit, about just 1% or so of the population in that study. Well, sorry, 20%. So, but the most one, Johnson & Johnson had more, like almost 18% of blacks in that study, which is actually encouraging with the J&J. So it's important that, we continue to encourage us to participate in clinical trials. I know, I'll touch on this later, but just to give us an idea that the vaccines are one of the most important steps we can take to slow the spread of this virus. And these trials struggle to enroll minorities in the trials. And that's one of the things I'm working on, is to encourage more of us to participate and identify sites that really recruit patients of color to participate in the trials. And there's funding for that. So if you can't make it to work and things like that, there's some compensation because folks want to get folks involved. $1 million available to cover some of those costs. Now, some of the side effects. We talked about the vaccine. What are the potential side effects we can experience from this vaccine? Most of the ones that reported like pain, most of you have felt pain after the virus. Felt some redness and swelling after getting the shots and depending on the arm. And then throughout the rest of the body, you get tired and weak, and headaches, muscle pain, chills, fever, and sometimes you get nauseous as well. And some of these side effects are expected actually, because it means that your immune system is actually working, right? And that's what we want to happen. But sometimes some of us are allergic or have some type of reaction Yeah, so if the redness or tenderness, still gets worse after 24 hours, please contact the doctor, because after the shot, they tell you to sit down for a little bit, right? To make sure nothing happens, and that's what they're kind of monitoring to make sure you don't flare up and get really worse. So please encourage others if they have that. These side effects shouldn't deter them from getting the vaccine. It's actually, I'd rather get these side effects and not die and get hospitalized. So, we're all in this together, I think. So we need to, whatever affects our brothers and sisters, affects all of us. We pray together in church. So if somebody gets the virus, it spreads really fast and uncovered. So one thing I want to stress about is the most vulnerable people in our population, the pregnant, right? The elderly, people with other health conditions, who have diabetes, who have cardiovascular disease, those who have cancer, heart conditions, and also other, there are on medications that really weaken their immune system. These are the most vulnerable people in our population that we need to really take care of. So in order to take care of them, we need to do our own part, because we're all in this together. Wear your mask. The numbers today shows about 95 million plus people in the U.S. currently have current cases of COVID-19. Globally, it's about 615 million around the whole world, but it's spreading fast, especially with the new variant. So let's just take care of each other. That's very important. Now I'm going to talk about some of the things that you've heard in the media, some of those myths that we've been talking about, and why it's not right, some of the misinformation out there. And I'm going to talk about the ones that are true or false. So one of the ones that I think is absolutely false is that you don't need a vaccine if you previously had COVID-19 and you've recovered from it. It's absolutely false. A COVID-19 vaccine will make you sick with COVID-19. Absolutely not. That's false. COVID-19 vaccine will alter your DNA. You've all heard that in the media, right? In social media. It's absolutely not true. It's not true, y'all. Absolutely not true. Vaccines are likely to affect fertility. For those who want to get pregnant, it's not true. So please don't do all that. COVID-19 vaccines contain microchips. They're tracking us, right? No, absolutely not, y'all. It's not true. It's false. What is true, however, is that COVID-19 vaccine does help us from getting seriously ill, right? Even if you get COVID, it still helps you from getting worse. COVID-19 vaccine, the reaction can range from mild to be a little less, and then it can be severe. But it resolves on their own over time, and you get the really you need. So that's very true. Getting vaccine yourself may also protect people around you, right? That's true, absolutely true. Particularly, like I mentioned, people who are more at risk, like the pregnant and the elderly, and those folks in our community. But it's also recommended that we get the vaccine if you're trying to become pregnant now, if you're trying to get pregnant later, or even if you're currently pregnant. So it shouldn't matter. It's actually true that it's recommended for those who are pregnant, who want to get pregnant, who are pregnant, who even want to get pregnant in the future. It's safe to get the vaccine. But always talk to your physician or the doctor before you do so, so they could actually notify you of charges. Symptoms of testing. I talked about the COVID-19 symptoms earlier. So it's important that we get tested. It's important to call ahead if you want to get the vaccine, and the physicians know, or sometimes the pharmacists also, some of the community pharmacies that we have in our neighborhood. Please, if you get the virus, I hope you stay home, or if you get vaccinated, stay home and make sure that, because you're going to get those symptoms, you're going to get a little sick. So don't go back to work immediately after getting that, just to make sure that everything is good. And when you do have symptoms, please stay home, distance yourself from other people as much as possible. Don't go out. Seek medical care immediately if you have to, if your symptoms worsen. So when do we need to get tested? The CDC recommends anyone with signs and symptoms, all symptoms of COVID-19 should get tested. If you're coughing, you feel it, you mean that, yeah, you got COVID, something's coming, right? It's in your throat. Please get tested, regardless of your vaccination status, whether you're vaccinated or unvaccinated. need to test if you had close contact with someone with COVID. If someone says, oh, remember so-and-so had got COVID, they didn't know about it, when you were sitting next to them in church or someone in the store, please get tested. If you're traveling places, get tested, just to protect others around you. And I know sometimes we may get the virus and not show what symptoms, right? It happens. It's happened to me too. So please, let's continue to test if we feel like something is coming. It doesn't really cost much at all, but it protects other people from dying from it. So let's do that. And the guidelines continue to change. It changes every 2 years ago, it's changing every week. Something new, it's still changing with new things coming on, new research going on. But there's the current guidelines, and I have the site here if anybody wants it. I can talk to you all after this, but the current site of the CDC is up and running. It's really current and continues to change. But just for us to know that it's available. Now, some other things I want to talk about is who needs a COVID-19 test. We talked about this. I'm not going to beat the dead horse here, but if you're positive, isolate for 5 days, at least 5 days, if you're positive. Seek a confirmatory test. Follow up with a lab test, the PCR, right? Instead of the antigen test you get, do a PCR test to confirm it, and recommended by your healthcare professional. But continue to monitor those symptoms, right? You have difficulty breathing, you're feeling weak. It could manifest in different ways, and everybody does it differently. I might just be running and I still have COVID, but I still have COVID. So I may have COVID and be able to run, but other people may not. So it's important to understand that the symptoms don't apply to each and every one of us. So let's be aware of that, please. If you're negative, however, if you're up to date on your vaccines, return to your normal activities, right? If you test negative, continue to do what you're doing. If you're not up to date on your vaccine and you have symptoms or you're exposed, go to quarantine for at least 5 days. Okay, please do that. And it's not up to date. If you're not up to date on your vaccine and you have no symptoms at all, or you're exposed, then you can return to your normal activities too. That's perfectly fine. But the CDC recommends anyone with signs or symptoms of COVID, whether you're tested or not, regardless of your vaccination status, to please just monitor and keep yourself safe and make sure you quarantine as much as you can so you don't get get your booster shots. Next thing I want to talk about is some of the myths here. So these ones are interesting. I want you guys to listen to this. Remember, we go to the pharmacy, there's vitamins, there's the vitamin C, the magnesium, and all this other stuff that people are taking. So the vitamins, the mineral supplements, can they cure COVID? No, absolutely not. So people go to the pharmacy and pick up all these things to help boost their immune system. It doesn't really cure COVID. I heard mosquitoes can give you COVID. That's not true, y'all. It does not give you COVID. It's been speculated, but it's not true. Also, what's false is that people talk about self-test. I think you test yourself, and what it tells you is that the antibodies, the self-test that we take will tell us that we have antibodies for COVID. That's not true. The self-test does not do that. Absolutely not. The titers that could be done in the lab that really tells you the level of immunity you have, but not the self-test doesn't tell you if you have antibodies for COVID. Now, this is interesting because I went to visit my family in Nigeria, and they're like, yeah, it's hot here in Nigeria, it's humid, it will stop the spread of COVID, we don't have COVID over here, it's hot, it's going to kill the virus. It's absolutely not true. It gets hot in Florida, right? But it doesn't stop the virus from continuing to spread. So please, sunny and hot weather does not really stop the spread of COVID-19. So that's false, y'all. What's true, however, is that the cases of the infection, the more people that get infected with COVID, it does happen, especially most people who have protection. So if you have COVID, it doesn't mean you can still get COVID. It's true, very true. The risk increases steadily as you age. The more older you get, the more risky it is for you to get COVID, especially those over the age of 65 who have an increased risk for severe illness. Even if you tested negative for COVID, you may still need to quarantine as well. That's true. So I'm going to wrap up here in a few minutes, but I want to talk about some of the possible therapeutic options here. And I'm not going to go too specific because I don't want to talk about every particular class-wise, just bigger umbrella. The therapy is called monoclonal antibodies. You all have heard about monoclonal antibodies. These are medicines made in the lab that make it helps block the virus from getting into our cells. Some of us in the hospital will get some monoclonal antibodies that are available. Some of them are no longer protected from this new variant. But these are developed in the lab. It really helps us to block the virus from getting into our cells. And that's what a monoclonal antibody is. And I'll talk briefly about it again, but I think it's important to know that monoclonal antibodies are a class of medicines that are also available to help us in fighting the virus. The next one is antivirals. You've heard of Paxlovid on the pharmacy. You've heard of remdesivir, right? Once we get it in the hospital, so now we can get it outside the hospital too. Those disrupt the virus. So the virus gets into our body, it replicates, spreads, but this antivirals help prevent it from replicating. So it protects the virus from spreading into our body by stopping it in its tracks. That's what antivirals do. So we have monoclonal antibodies, we have antivirals, and now the last one is called immunomodulators. These are therapies that lessen our immune system from being overactive. Imagine, being in New York, you hear the trains, the sound, the honking, and the immune system is on fire. The immunomodulators are therapies that help keep it calm, right? It lessens that overactivity that our immune system experiences. So those are other options that we have too. And now, the non-therapeutic options, we have oxygen therapies that help. I had a patient, a friend of mine actually, who had non-invasive oxygen therapy. Some of them had when oxygen hypotheric just because of COVID, difficulty breathing. And some had invasive, got intubated and got mechanical ventilation tracheostomy to insert. So some of those options are available for those who have severe cases and can't breathe and need oxygen. In addition to therapy as well, those who help as well. So what antibodies? These are proteins that are made by our bodies to fight infections. I'll talk a little bit about that. So that's what the antibodies are. They're just proteins in our body that helps us to fight infections, and like the virus that causes COVID-19. They do other things too, but in this case, that's what they do. It takes days or weeks to develop in the body following you getting exposure to SARS-CoV-2, which is the virus that causes COVID-19. But we don't know. It's unknown how long these antibodies develop, how long they fight against the virus, how long it stays in our blood over time. It's really not specifically known. Another thing is antibiotics are not antibodies. Absolutely not. So people conflate that. They're like, yeah, I want to get my antibiotics, but it's antibodies that they're better than. So how do we get the antibodies that help us out? It's through vaccines, through the monoclonal antibody treatments that I mentioned earlier, and also through natural infection. So when you get infected, you also get antibodies that help prevent you from, getting infected again, or actually help you respond to an active COVID-19 infection. So that's what antibodies do, especially if you have prior natural infection. Now, last myth is people who do get COVID-19 will have their health information made public. True or false? False. Absolutely not. False. So supplements, I talked about the supplements can cure COVID. Absolutely not. Now, this is interesting. Hydrochloroquine, right? You heard about hydrochloroquine. Does it help prevent or treat COVID-19? No, absolutely not. People still use it, believe it or not. It's even what's the other one that you use for horses? There's another therapy that you use for horses. Ivermectin, thank you. People are still using that in Alabama, believe it or not. It's insane. So, last but not the least, steroids. You heard about steroids. Are they recommended for severe and critically ill patients with COVID? Yes. So yes, to patients who need steroids in addition to other therapy like antivirals, or sometimes in addition to some of the monoclonal antibodies as well. Antibiotics do not treat COVID. Adding pepper to our soup or making it spicy to our meals does not prevent COVID. But it's important to understand that we need to stay hydrated, rest when we have when we're exposed to the virus, when we start having symptoms, to really take time off and get rest. So my last topic is why do we need to participate in a drug or a trial? It's important, and why do they matter? Now, these trials are being conducted mostly by pharma companies and by the government, by the way, and some hospitals, research institutions. These trials are part of what makes it available to science and medicine to advance, right? For us to have therapies like, for example, for heart failure in African Americans, there's that drug called Bible, right? I don't know if you all heard about it. It has the hydroxyzine and some other isosulfide nitrate in it. It's a drug for just African American, for us, for black folks, for heart failure. That drug is available and it was studied mostly in all Americans, but it was predominantly successful in black folks, right? So if we didn't have that scientific advance, if people did not get into that trial, we wouldn't know that we had a therapy that works better in certain populations than others. Just as an example, so it helps us prevent disease, identify what works in one population and what doesn't work in another population. It also helps treat these diseases like HIV, right? It affects more of us than it does affect some of the other cohorts. And now we're almost to the point where you can get a pill that will last you for 6 months, sometimes a shot for a year or so. So we're making those advances. We wouldn't make them if we do not participate in these clinical trials. So please, y'all, if you guys talk to folks and if you're able to participate, it's really something I'm passionate about, that we really need to get folks involved in clinical trials. I couldn't stress that as much as I can. But diversity is important in these trials because some of the reasons I just mentioned. Because they help us experience, they help us understand that people should be treated differently. What works for Tom will not work for Andrew, right? Because we're different people. Our genetic makeup is absolutely different. So we need to understand that it's essential that we include people like us in this trial so we're represented. And not just, like some of the vaccines, some of the trials. I mean, diabetes, for example, some of the drugs we take for our blood sugar. Some of them don't have most of us in the trial, but we're taking it, right? But it does help us, but we need something that would be more beneficial where the numbers would be really high. We're like, you know what, this would do the job right away, than taking a longer time to really work. So things like that I think is important because if done well, all of us, our communities will benefit absolutely from these scientific advances. That's why we need to get involved in these clinical trials. And underrepresentation in research is just remarkable. Companies are trying, but they're not doing it. They're not. So we need to really educate each other and our communities to do so. I'm going to stop here. I want to thank you guys for listening, and I really appreciate it. I hope this message resonates and take you back to your family, your friends, and tell them that it's okay to really get vaccinated. It's okay to stay safe. And if you have questions, I'll be here this afternoon to answer my questions. So thank you so much for having me. I appreciate the time today, and I'll be here for any questions you have.
Thank you so much, Dr. Kano. I wanted to ask a question. That was actually posed to me about Paxlovid. Actually, one of the members here was saying it seems that they're keeping that medication from us, and it could cure us or make us feel better much sooner. And the president got it, so why can't I get it? What do you have to say?
There's issues with access generally. It's not just us not being able to get it. There's been access issues with Paxlovid. But again, there's readout issues
why are we trying to take this one if we don't need it? That's my thought. Anybody else have any questions for the doctor?
First, when you test positive for the virus, I was told that after 5 days, the medicines
Like a Paxlovid or
they won't do any good after 5 days. So usually, first 2 to 3 days, you can take those medications. Other than that, it's no good. Is that true?
Yeah, it's tricky, but some of the drugs like Paxlovid have to have symptoms for at least 3 days or so before you take it, and it's a 5-day course. Some of the other ones, that's the only one that you can get as in the pill form, in the tablet form. The other one is remdesivir, which you can get through IV. You can get it, 3-day course, or you can get a 5-day course. If you have if you're severe enough, or you have oxygen requirement, then you can probably get it up to 10 days. But it's not, and every patient is different. I'll take this talk to the other, about it, but it's not specifically. The remdesivir is basically for 3-day course of therapy. 200 milligrams loading dose and 100 milligrams day 2, day 3. Same thing with when you're in the hospital, you can get it also for 5 days, right? But it's not specifically the pill one. It's the only one you can get outside of the hospital in the time of formulation. But you have to have symptoms for at least 3 days, I think, before you can get the time. Anything to add?
So for things like Paxlovid and what I'm going to briefly mention for the influenza virus, if you're isolating for 5 days with COVID or you're expected to get over it in 5 days, there's really no point in taking it after that at that point in time. By then, you should be building your own immunity to it and being able to fight it off. So you're kind of getting to the end of the course. Everyone is different, as you said. Everybody's symptoms will be different and how long they last will be different. Some people feel great after 2 days, some people 2 weeks, and they're still calling saying I'm coughing, I'm having trouble breathing and things like that. So there are lots of medications that we give, and they're mostly for viruses that you really get the most effectiveness in the first couple of days of treatment. So that's the second question.
A second question was that my daughter had that VA file, and she was sick for like 3 weeks. But she said the only thing to make her feel better was she went to the beach and sat out in the sun, just laying out in the sun. But you said the vitamin D from the vitamin D's and all don't help. She said that helped her. Just being out in the fresh, the salt air, she said it really helped.
What he was saying was those vitamins don't cure COVID. People go and Walgreens and CVS, they love you guys because you can find all their vitamin supplements. They don't cure it. So different things make different people feel better. You may do some saline irrigation, you may put warm washcloths on your face. Because this last variant, there was a lot of congestion. I could hear it when I had patients or friends. You sound like you had COVID because it's a congestion that was just different from your regular allergies or your regular cold. You could tell, like, I need you to go home and get a COVID test because you are super congested. So there's different things that help people. I like sun therapy too. And for some people, during the beginning of the pandemic, we would tell people, don't just lay in your bed and isolate yourself in that house. I would tell them when your family's gone and it's safe for you to come out and not spread it, go outside, sit on your porch, get some fresh air. So there's many benefits to, getting sun and getting fresh air, but everybody's different. Everybody's different. Different things make different people feel better. Okay. Yeah. So just like any other virus, this can happen. Okay, you can have food poisoning and lose your appetite. You can have influenza and lose your appetite. Yeah, there's lots of different reasons for that too, but for any prolonged symptoms, I would say definitely go see your healthcare provider. Because we may say, and just assume, that's just the COVID, but there could be something else underlying, which is why you need to see the primary Y'all know I'm a big proponent of that. Y'all need to go at least once a year. It's not a surprise. Yes. Yes, so typically if you got your booster where you were supposed to get your booster and it was registered, you should get an updated email or text or something telling you when it's time for your next one, telling you, hey, you should get, well, when you get it or if you talk to your healthcare provider, usually it's about 6 to 8 months after you get the last one, right? And they change some depending on the the one that you got, but pretty much, yeah. If it's been 6 months.
So is 2 boosters and then now it's another one?
So, okay, let's think about it this way. When we had our babies or grandkids, we took them to get, let's say they got their first Hep B. About a month later, you had to get another one, or 2 months later, you had to get another one. So some things, you're gonna have to get several in order to get the immunity you need. Things like influenza, you're gonna have to get every flu season. COVID-19, because it's varying so much, you're gonna have to get boosters. I'm not saying indefinitely, we don't know how much, but every time there's a different variant or there's a surge, you're gonna wanna boost up those immunity, those antibodies again, because it doesn't last forever and it doesn't last clearly even a whole year. So we may be getting boosters for several years, several times a year.
So it's gonna be more than like twice a year possibly on the booster, right?
It could
Does
be
that mean
more.
I tried to take my booster, I got COVID, so I never could get the booster. So how long after we have COVID that you don't get the booster? Because I had COVID 3 times in 4 months.
So, to my understanding, they're not telling you to wait anymore. It used to be 90 days, and the reason was because you were thought to have antibodies for at least 90 days after you had COVID. So they would say you can wait and get your vaccine or your booster 90 days later, but you don't have to. And if you don't have unless you got the monoclonal antibodies, you do need to wait then. But otherwise, you don't have to wait.
And so I guess when I had it, I had influenza, COVID, and tonsillitis. All 3 of them.
Yep.
And
Yep.
it wore me out.
Yep.
And I am so fatigued, I'm still fatigued.
Yeah.
I didn't take the blood. I'm getting that back together, but
Yeah. So your body's going to need time to recover from anything, and if you have that many illnesses all at once, you're going to have to make sure that you're eating healthy. My other favorite topic, getting the right amount of exercise, and if you eat the right food, you don't always need the supplements of the vitamins, but sometimes we're not getting everything we need in our food, and of course they're modifying our foods and putting hormones, or we're cooking the vitamins out. So just making sure, my favorite saying is what you put in is what you get out. So if you put junk in, you're gonna get junk out in the form of prolonged fatigue, tiredness, shortness of breath, things like that, joint pains. So if you're not moving and exercising and lubricating those joints, then you're gonna feel kind of like stuck down and tired.
thank you.
You're welcome. Yes, ma'am.
Can you change from nervous to positive?
Yes, you can.
Every time I have a nervous, every time I take it, it makes me sick.
Yeah. So you are one of those people who are probably mounting a great immune response. If you get sick from it, then that means your body's already trying to fight it. So to me, that's a good sign. People who say they got the vaccine and they feel nothing at all, I'm worried about them a little bit. Yeah.
I have a question, but my question is kind of directly related to COVID. Brand medication, generic medication. I have an issue with a lot of the companies don't want to give you the brand medication, but afraid to give you generic.
So that's a separate topic. There should not be generic COVID medications right now.
Well, no, I'm
So that's going to be all about cost. You are in the U.S. of A. Capitalism and insurance companies are willing to keep costs down There are a couple of medications where they're not allowed to switch it out if your doctor writes for the brain, but pretty much everything else they can. So thyroid medicine, Synthroid, you're not supposed to switch it out. Digoxin is that one, and then what's the other one? I'm trying to think. Yeah, so there's some medications that actually are a little bit different, and some people have a different reaction.
To add to what Mr. Crowder is saying, the reason why they have generic and brand is because the FDA gives the company a certain number of patent life years that they can work, more market the drug as a brand medication, and it's more expensive. So within 5 to 10 years, right, it's a brand medication. You sell it on, market it, and sell it within that 10 years. After that 10 years is over, it becomes a generic medication. So not necessarily that the ingredient in the brand and generic, they're very similar. It's almost the same thing, right? Except for some of the little inactive ingredients, like cellulose or some things that are added into it to make it just a little cheaper, but the active ingredient is the same.
And all it means is, once it's no longer branded, any company can make it. That's what makes it generic. So, if you get your medications online, you may want to watch out for that, because it may be made in a factory where things are not actually, if they're not, Yes, ma'am.
I know back on to what she's saying, I found out a lot of my generic is higher than what the formula price of the brand. That I don't understand, because I know Dr. Yama, you got generic, it was a lot cheaper, a whole lot cheaper. But now it seems like generic is gone up.
It depends on the medication, it depends on the company, it depends on the pharmacy. There's a lot of factors that play into the cost of medications, and your insurance is going to give you a formulary. Trust me, as a prescriber, I have a very hard time, because I may have to change the medication. I write it, I'm guessing. I try to start with the generic because I'm about cost, but sometimes I get a note back saying insurance won't pay for this, and you need to write it this way. So it's an all-day battle back and forth.
That's one of the reasons I asked that, because I work with Florida Group. I get those calls all day.
Yeah, all day. So, yep. So it sounds like I need to come back to the pace setters and do my medication talk again. I think I do. Okay. All right, so let's move on to the flu, influenza. Okay? Yes, ma'am.
Is Walgreens has the new,
The Novavax.
Because sometimes it's not easy to switch from one to the other, from Pfizer to Novavax, because sometimes they're different types of, they're made differently. So one has an mRNA, the other one has a different method, but it's good to talk to the doctor before you choose which one you want.
So the flu is a contagious respiratory virus that affects the nose, the throat, the lungs. There's type A and type B that are responsible for what we call seasonal flu, right? So the best way to, we'll get back to that part. So flu season, when is flu season? Right now, fall and winter. But we do diagnose the flu all year round. We do. It's best to get your flu vaccine before or during flu season, though, okay? And we usually see increases around October, and it peaks between December and February. But it can go as late as May. So what's happened because of COVID is the flu is a little bit less predictable. We're not able to predict how it's going to act anymore. So during the pandemic, we saw a lot less flu. I probably diagnosed maybe one during the whole pandemic. And you know why? These things on your faces. So it's a respiratory virus, right? It's just like a cold. I didn't see people complaining about the cold, the flu, none of that. Because we had masks on and we were actually washing our hands. Like We also had RSV. People may have been hearing about that. We used to only see that really in kids, but now that's on the rise now that we've taken off our masks. RSV is a respiratory syncytial virus, so it's another type of respiratory illness, and it can be very serious. Any of these problems can be very serious. The reason why we have vaccines against things is because they can lead to death. So we definitely have death from the flu, just like we do from COVID. And I did have some statistics. The deaths as of September 22nd from what we call the PIC, pneumonia, influenza, and COVID, 9.2% have been due to pneumonia, flu, and or COVID-19. This is above the epidemic threshold of normally 5.6% for the week, okay? And among the 2,058 deaths from PIC or pneumonia, influenza, and COVID, 1,000 were from COVID. Yeah. So still COVID is a lot higher as far as the death rate. And I wanted to show you as far as Florida. Now, surprisingly, Florida is in the minimal, no, actually in the low rates of flu right now. So you see this is the U.S. The green is pretty low. We're like a lighter green, which is getting up a little higher. DC, red. So they have a large amount of influenza and influenza deaths right now. So what does that mean? Why do we care about DC? Travel. Okay, when we take airplanes, buses, trains, we are with other people. We can be exposed. I hate that they took off the mask mandate for airplanes. If nowhere else, public transportation should be required to have a mask. So I encourage, over a year ago, I encourage you to still wear your mask because it's always been a high risk. You're in this small space without actual fresh air, recycled air. So not only are you at risk for COVID-19, influenza, tuberculosis, people have all sorts of respiratory illnesses. You don't have to. No, they cannot mandate it. They can no longer mandate it on the plane. They can request it and prefer it, but they cannot mandate it. No, they don't. It's not required anymore.
Yeah, keep yours on.
Keep yours on. They can do what they want. I'm keeping my mask on. And I'm still writing down my ear. Yeah, they're coughing, they don't wash their hands. So if you are infected with influenza, you can actually detect the virus one day before you start having symptoms. And the only way they know that is from doing trials and research studies. And up to 5 days after you become sick. You're most contagious in the first 3 to 4 days, okay? And people who have a lower decreased immune system can be actually contagious for longer than 7 days. But symptoms typically will start 2 days after you're infected. So if you're around someone who has the flu, then that's when you want to start paying attention and wearing your mask and washing your hands and staying away from other people, making sure you got your vitamins on deck, you're staying healthy, you're eating right, you're exercising, okay? And so we talked about, when to get your vaccine. So if you haven't already gotten your vaccine, September, October is a good time. That's why you'll hear all about the flu vaccine drives. That's why we have Walgreens here today. They were outside, but they actually prefer to come inside to do the vaccine. So we will have them in those one of the first 2 rooms. Yes, ma'am. The shingles shot. You can. Yes. So your flu shot, we don't really have very many restrictions on it. We want people to get it. They were giving the flu and the COVID at the same time. You know, when COVID we were first in the pandemic, there was a lot we didn't know, so they were a little more cautious. And they may have said, wait 2 weeks or wait a month, but no longer. Okay, we're trying to get you while we can, because they're different viruses, so you're just gonna develop that immune system differently. Remember those babies again, they would get 5 shots at one time, very often. Yes. Okay, so, and again, the vaccine is the best way to reduce the risk of death from the flu. Okay, so for anyone 65 and older, you do want to get the high dose influenza vaccine. Okay, if you have anyone who is, what's the age they want to give 2? So certain children, they usually get 2 doses, and they're a month apart. Okay, and the flu vaccine is for anyone 6 months and older, all the way up. Now, $199. There is a nasal spray form of the influenza vaccine, but that's only recommended for people ages 2 to 49, the healthiest, typically the healthiest population, only because that one is the live virus. So if your immune system is down, you don't want to take that one. And if you, even those 2 to 49 are not all recommended to get the nasal spray. Okay? So just like he was talking about with the COVID vaccine, the flu shot can give you some symptoms of, soreness, redness, maybe a little swelling. You may feel a little weak or tired, but again, that's likely your body building that immunity to the vaccine. And there used to be a recommendation that if you're allergic to eggs, you do not get the flu shot. That is no longer correct, especially if you just have like hives or something like that. It is, however, recommended to get it in a medical setting. Okay, so this is not the one that you typically want to get here at your church health fair or somewhere else in the community that's not an actual pharmacy or a doctor's office or hospital. Okay? There are some egg-free vaccines available, but they're not widely available, so I'm not sure if Walgreens has any of those today, but those are for people who are extremely allergic to eggs and have severe reactions to them. So some of the symptoms from the flu are fever, chills, cough, sore throat, runny or stuffy nose, muscle aches, body aches, headache, fatigue. Sound familiar? What does it sound like? COVID, nausea, vomiting, diarrhea. Typically, those are seen in children more so than adults. And one of the myths about GI symptoms is this whole thought of a stomach flu. There is no such thing as a stomach flu. If you just have nausea, vomiting, diarrhea, you just have what we call a gastroenteritis. It can be from anything. It can be from a virus. It can be from food poisoning, but there is no stomach flu. You can have stomach symptoms if you have the flu or if you have COVID. But because the symptoms are so similar, this is why we're so vigilant and telling people you got COVID. To me, you have COVID until proven otherwise. If you have allergy symptoms, if you cough, sneeze, you stuffy all of a sudden, your nose is running, you got fever, your throat is sore, this last day I'm in a lot of sore throat, that's worse with the cough. Do your COVID test first to make sure it's not that. Go see your doctor. They're still doing virtual visits. I know we were doing visits where you drive up and park your car outside of the office, and we call you up and we virtual visit, and then we come out in our hazmat suits, swab you. We swab you for the strep, flu, and COVID at the same time. Okay, and that way we can give you a good diagnosis of what you do or don't have. Okay, even if all of those tests are negative, you have all these symptoms, you need to isolate. Because sometimes the tests just don't pick up what you have. Sometimes it's too early in your symptoms. And if you don't have those, it does not mean you don't have another virus. Okay? So the treatment for the flu, no cure. There's no cure. Again, we do want to start, Tamiflu is the most popular one that we do. We do want to start that within 48 hours of symptoms. And it still doesn't cure it. It's thought to decrease the length of time that you have it. Okay? But again, you want to do those things that are healthy for your body. Trying to move around a little bit, eating healthy, getting lots of rest. Rest is the best thing for all of these infections. Yes, ma'am?
Getting back to the COVID, you know that FBC is setting out all these COVID tests
may give a false negative. More than likely, to me, it would give a false negative rather than a false positive, but either way, if it's expired, don't.
So they started sending them on May 6th in September, right? Probably around June, July. They were expired.
They were already expired.
Yeah, well, I mean, they had already expired, so, you know, the one I got yesterday, it's good to 2023.
Good.
But the previous one, they're already done.
Yeah, throw it out. Throw it out. I know the first big wave of the free tests they were giving out, the home test. For some reason they had a lot of them, but the health department didn't give them out immediately, and so come December they were trying to get rid of them. So I had a bunch that were expiring December 31st. And what we did was we just called around our friends and texted and said, hey, anybody need a COVID test? And then people started calling us that were about to go on a trip. Hey, I need a COVID test. I can't get one. I can't find one. So just give them out if you know you're not going to use them before they expire. But definitely if they're already expired, go ahead and throw them away. Any other questions? Any questions about the flu? Everybody is going to get their flu shot today if they haven't already. No, flu. So flu is just abbreviation for influenza. Same thing. Flu shot. Flu shot.
If I had
Yeah, you had flu this year already? Same thing. Flu, influenza, same thing. You had flu this year.
about 3 weeks ago.
4 weeks ago. Okay. You need to talk to your doctor. Yes, you're on time. Anybody else? Any other questions? Yes. Of what now? Bronchitis. Bronchitis is fun. So bronchitis is not what most people think. Most people think bronchitis, you're going to hear a bunch of stuff in your lungs, you need an antibiotic. Bronchitis is typically caused by a virus. Your lungs should be pretty clear. If your lungs are not clear, then we're starting to think you might have pneumonia. So that's different. But that typically gives you fever, probably some chills as well, weakness, fatigue, tired. If your lungs must be listened to, then you have to go in. You got to go into your primary or to an urgent care to get somebody to listen to them.
So they told me that if you got any symptoms that are similar to COVID.
Right. They don't want you in the office. Yes. Not all offices are doing that, but some are still being very cautious. It really just depends on their personal preference and what they've had happen. So some offices that have had to shut down because they had so many people coming in with COVID and infecting their staff, then they do adopt that policy. But yeah, you'll need to have someone actually listen to your lungs if you think you have something in them. And one of the ways you can tell is when you're short of breath or it feels heavy, if you're coughing up stuff that's actually coming from the lungs. Because sometimes we kind of do the nasal thing and, clear your throat and you cough that up and you think, oh, I'm coughing up green. That may not be coming from your lungs, it may be coming from your sinus area. So those are some of the symptoms. Definitely shortness of breath, what we call air hunger, where you feel like you can't catch your breath. You need to be listened to. And I've had patients that I've had a virtual visit with, and they call back maybe a week later, I'm not feeling well, and I can kind of say, you know what, you need to come in. But if I know you have the symptoms, then I know to take the extra precautions, put my visor on, my gown, and all of that, and then I'm going to listen to your words. You're welcome. Yes, ma'am.
Can pneumonia give you cancer?
Can pneumonia give you cancer? No. No.
Well, I had some medical people say that.
No. I don't know how they got that. You can have pneumonia and have nodules in your lung that they biopsy and discover are cancer. And sometimes you're treated for pneumonia multiple times when they see something on your X-ray in your lungs and they thought it was pneumonia, but then they later go and say, this is not clear enough. That's why follow-up is so important when you have any kind of infection or problem, because you may think, okay, I got this pneumonia, I'm going to take this medicine and I'm fine. You still need to follow up because you may need to have another a lung nodule versus part of your lung being collapsed. So that's why follow-up is important. But it cannot give you cancer. Any other questions? Okay, here. Oh, yes.
My friend who went in to get COVID, went to get the COVID test, and there's a new bivalent vaccine together had severe reactions from both. 3 days bedridden, couldn't do anything. And is this still encouraged? Would you still encourage you to get both of them on the same day?
To get the vaccine?
And the flu shot at the same day, both.
Yeah, for most people, it's okay to do that. If you had a severe reaction and you don't know to which one, then those are the ones who need to separate them. Even the childhood vaccine, sometimes they have to separate them if the kids have a reaction to, like I said, they're getting 5 shots at a time sometimes. Hepatitis, the influenza, the pneumonia, the MMR, whatever. So you can break up your vaccines. And if you know that you're a person that has bad reactions to things, go ahead and just get them separated. And if you feel like, oh, I don't want to really be without either one and be out in public, then don't be out in public until you are fully vaccinated and you're ready. Any other questions? Yes, ma'am.
The drug trial, how do you find out about the different drug trials?
So I would start with the CDC website. You can go to Pfizer's website, Moderna, all the ones who are doing the trials. You can check with their websites. They will be happy to send you information. They will email you.
CDC, just go to minority and clinical trials, and then get to the CDC guidelines, and that's where you can find them.
So we do both have tables outside. So if anybody has any other questions, feel free to come by. We're going to be checking blood pressures and blood sugars. Y'all excited?
Yes.
Also, I do have some hands-on CPR kits that were provided, I believe, by the American Heart Association. There's tons of them. Take them home. Teach your kids, grandkids, family members how to use them, because that's just a whole nother topic that we need to discuss. The fact that people have heart issues and may, have a sudden death or a near-death experience that could be saved by just knowing how to do some simple CPR. So go get yourself a kit, get your HIV test, get your flu shot, and thank you all for coming. Appreciate it.
We have just completed our health awareness seminar and workshop. Thank you to doctors for being in place to lead us in the way. And tell somebody, if you're watching me right now, that on the yard of Open Arms is a whole lot of stuff going on. It's our Family and Friends Day, and we invite you to come by. Come by and free food, free fun. The kids got the game truck, they got the bouncy houses, they got giveaways going on. So come on by, check us out. But if not, see you tomorrow. Have a great one. Bye-bye.